Hi, I have 99 seconds to explain the issue of healthcare for Americans, so let's get to it. Each year it costs some amount of money to pay for the total amount of healthcare Americans need. Whatever the reason, the cost to any one person can be tens or even hundreds of thousands of dollars. If we don't group together to pay it, many of these people will suffer or die from not receiving healthcare. If you're okay with that, feel free to go and you've wasted less than 30 seconds of your life. Otherwise, stick around and we'll show you where the money has to come from. The government could pay it all, and nobody would need to die from a lack of health care. A health care tax would be based on a person's income rather than their health care needs. We already do that for many people. It could be paid by health insurance companies. That's how our current system works. People who can't afford premiums or their share of deductibles and co-pays still would die, but more would be helped because of the pooled money. But insurance companies are in this for profit. By definition, they have to take in more money than they spend on actual health care. That means some of your money goes to them. The government could give money to insurance companies to help them lower premium and other costs to Americans. This is how Obamacare works. It means that even fewer people will die, but the government still is paying and insurance companies still take their profit. As you see, the only way to ensure that every American gets health care and we get the most from our money is to remove insurance companies from the picture and have the government pay the nation's health care expenses. This is referred to as universal health care, or single payer. Of course, there are other parts of the solution we haven't talked about. Too much for the few seconds I have left. But now you've seen that we can provide health care to every American, and you understand how it can be done.